not only our management. Mr. Speaker, the public health sector is embarked on coordinating the preparation of a comprehensive National Health Strategic Plan for the next 10 years. The last National Strategic Plan was between 2000 and 2004, and we feel that we should embark on a 10-year National Strategic Plan. We would concentrate on prevention, protection, and good health rather than diseases, because we recognize that prevention is most important. The plan also provides for the strengthening the capacities of the ministry staff who have responsibility for the oversight and management of national health programs. External agencies, PAHO, and IDB are supporting this initiative. One of the subcomponents of the technical cooperation project with the IDB will finance assistance to review existing health regulations to identify issues that may need to be addressed to support achieving the strategic goals defined for the sector. Mr. Speaker, this is extremely important. We have to review some of our policies. Countries in South America, we still require to receive yellow fever vaccine when the United States do not. And that can pose problems to our Ministry of Tourism, and those are entities that need to be looked at and reviewed so as we can concentrate on the free flow of tourists from the South American market without any form of hindrance or obstruction. One of the goals also, Mr. Speaker, is to follow up on the enactment of revised legislation drafted to regulate medical laboratories and medical technologists. Mr. Speaker, during this budget period, the health sector will also benefit from assistance from the United States President's Emergency Plan for AIDS Relief, the PEPFAR, which will strengthen our national HIV/AIDS program. This, Mr. Speaker, will strengthen our information gathering, will strengthen our preventative arm, will strengthen our laboratory systems, prevention, and follow-up. But, Mr. Speaker, what this would do is it would standardize this entire entity, not only here in the Bahamas, but throughout the world with this PEPFAR. And later this month, I will be signing a $1.6 million grant through this PEPFAR agreement for the first year, after which there'll be a $450,000 for year 2 and year 3. And as I said, the objective of ministry under the PEPFAR agreement includes AIDS prevention and other entities that I've just mentioned. In addition, the PEPFAR would also help to strengthen the Office of the Chief Medical Officer for its planning and strengthening of programs that we have through the CMO's office. Mr. Speaker, I'm happy to announce that our HIV/AIDS unit, the laboratory system has expanded so that we now can obtain results in a more quick fashion, and at the same time, because of the improvement within our lab system, we find that individuals who were lost within the system are now returning for further investigations and proper follow-up. And this would help with reducing the spread of HIV/AIDS and would help in the entire preventative arm that we speak so much about. We are also, Mr. Speaker, in partnership with the Clinton Foundation, the establishment of a new adherence manager whose work had begun in March of this year. And the adherence manager, Mr. Speaker, through this foundation, would ensure that our patients adhere to the medication so that we can have proper compliance, rather than individuals taking medication a day and no follow through. But it would also help with contact tracing, which is most important. And Mr. Speaker, the ministry has made excellent communication and relationship with the private sector so that patients seen in the private sector may not be lost. They too would be engaged in the contact tracing, and it's only through public-private partnership would one be able to conquer and deal with the problems within the health arena that we see. Mr. Speaker, nursing is a very important component within our healthcare system. And the nurses are probably one of the more important health component or health entity within our system. Because without the nursing personnel there, our health system certainly cannot succeed. And yes, we have a shortage of nurses within our institution, and in fact, there's a shortage of nurses throughout the world. But, Mr. Speaker, 2009, our nursing cadet program, senior high school students who had entered the nursing cadet program, 127 of them, about 50% of them, of these individuals, went on for the bachelor's program at College of Bahamas, and 33, Ministry of Health had provided scholarships for 33 of those individuals. An additional 31 nursing students had commenced internship in May of this year. And Mr. Speaker, I should mention that in addition to those individuals receiving scholarships, they also received a stipend of about $475 per month. Mr. Speaker, we realize and recognize that there's a shortage of pharmacists within our country. And yes, the drug plan would utilize the pharmacists within the private sector. But we also have a program for training of pharmacists with College Bahamas and University of Technology in Jamaica. And 17 of our pharmacy students through the scholarship program has completed the first 2 years at College Bahamas and would soon be embarking in Jamaica, University of Technology in Jamaica, to complete. This would be an additional 17 pharmacists who would be added to our complement within the Bahamas. And these individuals would be sent throughout the various family islands and clinics and here in New Providence to ensure that each and every one of our citizens have access medication, not only in a timely fashion, but in a safe fashion. Our legislative agenda continues. As for the first time, we have established a pharmacy council, and we continue to make progression on our new medical act as we deal especially with one section, the medical act, the intermediary license. I find it very difficult, Mr. Speaker, to have a section in the medical act where you require doctors to do 3 years before they can obtain a license, but yet at the same time, you only employ for 1 year as internship. What happens to that doctor during the additional 2 years if nothing is provided or no provisions made so that they can complete that additional 2 years? Mr. Speaker, that matter is being addressed so that we'll have a new medical act coming forth soon. We now have, Mr. Speaker, a state's officer who would be able to manage our clinics so that our public health sector would have a proper maintenance program. But I must thank both Ms. Charlene Bain, Administrator, and Ms. Elizabeth Keju, our Undersecretary, who had performed the duties